Good morning, everyone. So, when written in Chinese, the word crisis is composed of two characters. One represents danger and the other represents opportunity, said John Kennedy. The pandemic of the century hit the entire world out of nowhere, and thankfully, we seem to be emerging on the other side. The current global pandemic has been devastating to communities of color, exacerbating and exposing long-standing inequalities across a range of systems. So we decided that the AHNS should make this the topic of this symposium, as this is really a rare, once-in-a-lifetime educational opportunity in terms of scientific, public health, and personal response to this global crisis. Every little thing counts in a crisis, said Jawaharlal Nehru. The scientific world responded magnificently during this crisis, and I think there'll be a lot of books written about them. So today we have several experts here who have personal stories and were leaders during this crisis and will share their insights on how the ENT head and neck community responded to this emergency. I want to introduce and thank our two program chairs, Dr. Melanie Nance, Assistant Professor and Vice Chair of Education for the Department of Otolaryngology at University of Pittsburgh, and Dr. Dan Deschler, Professor and Vice Chair of Academic Affairs at Mass Eye and Ear Infirmary, who have put together a fantastic program that will address the conversations we need to have for the future of healthcare and future generations. Dr. Deschler, as chair of the Patient Education Division of the AHNS, and Dr. Farwell, vetted articles, information, consensus statements to share information in real time with members on our website, and it was a gigantic task. I also want to thank Christine and the team from BSc who helped us orchestrate the program. So finally, in reflecting upon how the world was turned upside down, we would be remiss to not remember those who lost their lives to this pandemic. And finally, I want to conclude with the words of Thomas Jefferson: to fortify our minds against great calamities and misfortunes should be one of the principal studies and endeavors of our lives. So today, it gives me great pleasure, an honor, and a privilege to introduce to you our past president, Dr. Ehab Hanna, who's currently professor and vice chair of the Department of Head and Neck Surgery at MD Anderson, with a joint appointment in neurosurgery, as well as an adjunct professor at Baylor. Dr. Hanna is internationally recognized for his expertise in the treatment of patients with skull-based tumors, head and neck cancer, and has also been president of the North American Skull-Based Society. Now, Hanna is a mover and a shaker, and once he has a plan, he orchestrates it beautifully. He restructured our organization, now known as AHNS 2.0, and the momentum the society has gained is palpable to all, and certainly made my job as president during the COVID year a lot easier. Dr. Hanna had a front row seat for COVID-19. He happened to be in Italy at a meeting when the pandemic hit, and fortunately was able to fly out to Scottsdale to attend the last in-person meeting at the US in February 2020. As editor of JAMA, Dr. Hanna dedicated an entire issue to head and neck cancer during the pandemic, and we look forward, after the introduction by Dr. Deschler and Dr. Nance, to his insightful talk on COVID-19, the approaching storm. Thank you.
Greetings and a welcome to this most novel of AHNS COSM meetings. Dr. Nance and I wish to thank Dr. Nathan and the AHNS for the opportunity to co-chair and develop the symposium. In this time like no other in the past, we seek to offer an academic meeting like no other. Today and tomorrow, we will discuss as colleagues and as friends issues of immediate and long-term importance. Day one will focus on the trial and challenges of the past pandemic year as we share our personal and professional journeys in this time of COVID. I introduce now our co-chair, Dr. Nance, who will discuss the highlights of tomorrow's meeting and also offer a few words. Dr. Nance?
Thank you, Dan, and it's been wonderful working with you. Thank you so much. Good morning to American Head and Neck Society from Pittsburgh for me. I really can't wait to get started. As Dan mentioned, we have an exciting day today, and tomorrow we even have more exciting slate of topics. I mentioned to Dan that my favorite part of AHNS meetings is really the part where everyone discusses, the experts get together, they question each other and learn from each other. And that's really what we have planned for tomorrow. We'll be talking about diversity, equity, and inclusion in head and neck surgery, palliative care, ethics, and our new normal in terms of meetings and conferences, training, and education. But first, I'd like to thank and introduce our illustrious president, Dr. Sherry Ann Nathan. She's the Jack Poe Endowed Professor and Chair of the Department of Otolaryngology, Head and Neck Surgery at LSU in Shreveport, as well as the Director of the Head and Neck Oncology, Surgery and Research in Feist Wheeler Cancer Center. Since the merger of our two societies, she is our longest serving president. And we thank her for her extra efforts that she has led the ship of AHNS through this storm. So thank you, Dr. Nathan.
Here, here. Ehab, we're looking forward to you getting us started. Please share your story and your wisdom with us as always.
Thank you, Dr. Deschler and Dr. Nathan, for this honor to be the opening lecture for this meeting and for the opportunity to share my experience through the title that was given to me, The Approaching Storm. I have to start by saying I have nothing to disclose. And the issue here is finding the real picture of an approaching storm, and this is the best I could do, but I would like to share with our audience that unlike any other storm that happens in one part of the world, this storm really was of global nature, which is different than some of the weather storms that we are experiencing every now and then. Well, before I delve into the meat of the presentation, I'd like to tell you that what you're gonna be hearing today from me is personal reflections. I will not try to give you a scholarly, didactic, statistics-filled and graph-riddled presentation, but rather walk you through one man's feelings and thoughts, and these are my own personal reflections. In fact, the rest of today will be plenty deep dives into some of the issues I'm gonna raise through the personal reflections, and your curiosity and your thirst for knowledge about the statistical and data-filled aspect of this will be quenched. I can promise you that for sure. I also would like to disclose, even though I put my financial disclosures, that this is really more of my personal reflections, as I mentioned, and in addition to having no conflict of interest, I have no political agenda. So the outline of the next 20 minutes is to talk about how the storm started in evolution, particularly in Asia and then through Europe, touch base on the landfall in the United States and the impact it had on society in general, healthcare in particular, with a focus on cancer, and a really zoomed in picture of what happened in our specialty. I also would like to talk a little bit about response and some lessons learned as we wrap up this presentation. So this is the timeline in China. And while this is a graph that shows sort of the peak of it, the dots here on the top show significant events during that time. Notice that this graph starts in early January. So I'm just gonna walk you through timeline in Hubei province, where the city of Wuhan is located. In December 29th, the Wuhan city government started to trace cases. January 4th, a lab in Shanghai detects the coronavirus that was similar to SARS. 2 days later, a Wuhan doctor and 13 nurses were all infected after operating on an infected patient. And I'd like to share with you that that was an endonasal procedure. This seminal case was really sort of the basis of our otolaryngology head and neck surgery awareness of the increased risk of our specialty and the response that many of our societies have done. On January 7, the pathogen was identified as a novel coronavirus, never seen before. Less than a week later, the incubation period was identified at 14 days. Social events in Wuhan, including the Lunar New Year banquet, started taking place. 3 days later, there was the annual Spring Festival, and there was a travel rush, as you can imagine, for people in China trying to celebrate New Year with their families. During all this mess, this ophthalmologist was trying to sort of alert the community that something is going on when he saw 5 patients with this novel virus and realized that human-to-human transmission is really rampant. Unfortunately, he did himself get infected and passed away, and his message was somewhat muted in the beginning, probably a bit because of lack of knowledge, and then also for the desire not to spread panic. And you can see how quickly things have moved in Hubei. Wuhan was placed under quarantine. They announced building a hospital in 10 days. A couple of days later, hundreds of medical staff and equipment was sent to Wuhan. And that was one of the hallmarks of the response in China, is that while the almost complete quarantine and embargo of the city of Wuhan allowed the government to send all the medical equipment and the medical workers to that one area where this one fire was burning or that one storm was forming. The field hospital on February 1st, and more hospitals were built overnight. You can see that another almost over 3,000 medical workers on February 9th were sent to Hubei province. Now this picture here depicts, and it went viral, 2 young doctors. The husband was being commissioned to go to Wuhan to fight the virus. And this was their goodbye right before he set out to travel to go to China. And it just one of those pictures that really touched me personally, way before I even thought that this is something we're going to be dealing with, because of the emotion of putting yourself in danger for others, and also the concern one has for their loved one running into the danger zone. We've all seen this massive response evolving on our TV screens, on our cell phones, and our web pages on our computers of how the Chinese government and the Chinese people responded in a massive way to try to contain this wave. And you can see here in my last timeline that donating plasma was starting to be sort of looked at as one possible therapeutics. More medical workers are sent. And then on February 26th, and this is the date where my personal story starts, the cases in South Korea and Iran started to pop up. And I had left to go to Italy on the 25th to attend a meeting. And before I went to Italy, I checked the number of cases in Italy, and it was 0. So this was the meeting that I attended, and it's in the beautiful city of Turin. And you can see this is February 23rd. That's where the meeting started. I was assigned the opening lecture as well. As you know, the Italians are very hospitable. And the night before, in the banquet dinner, they were serving some Prosecco, and they said, that's gonna protect you from getting the coronavirus. And I said, well, what do you mean coronavirus? You have no cases. And they said, well, we just registered about 20 cases in Milan this morning, which is the day before the opening of the meeting. Well, during my lecture, the organizer of the meeting came to the podium and announced that the fashion show in Milan was closed, that the Venice Festival was canceled, and that the soccer game was postponed. And as you know, when you postpone a soccer game in Italy, that's a very grave sign. It actually takes an act of God to do that. So I realized very quickly that the situation must be very dire. And that day they announced that over 150 cases in the Lombardia province or region were detected. And then by noon, our conference it was brought to a screeching halt, and we were asked to leave. Of course, I scrambled to get on a plane, and this is one of those days that I was really grateful that I had a good relationships with United Airlines, and I was in global services, something that my colleagues in my department is a point of consternation, because that means that I travel more than I work, which is not true, but that's what they say. But anyway, that day I was happy to have the global services line, which got me the last seat on a plane out of Italy before it went into a complete lockdown for people traveling in or out of Italy. So I landed in the United States, and this is February 27th. This is 3 or 4 days later. I kissed the ground when I landed in Houston, thinking I barely escaped being quarantined in Italy, which actually wouldn't have been that bad, but I had to come home because I had other things I needed to attend to. And this is the meeting in Scottsdale of the Astro Head and Neck Symposium. And this is the MD Anderson Group dinner. And this was literally the last dinner that I have attended with friends, without masks, in person. This was the last conference I attended, which is more than a year ago. But quickly, as I returned to Texas, I received an email that there was a COVID positive participant in the meeting. And for privacy purposes, we will not tell you who it is, but you may have gotten in contact with. In the streets of Houston, you can see that the barometer is getting a little higher. And we were at level 2 by early February. And then quickly, the emergency alerts on my phone started getting more dire, and how that COVID-19 was spreading rapidly across Harris County, which is the county where I live, and to stop gathering, get tested, wear a mask, and so on. Now, big storms like this don't start huge, but they start as pockets. And to create a perfect storm, you need several conditions and or lack of certain responses. And this is the picture today, but we didn't get to this picture overnight. And I'd like to play to you this, you can see here the dates by day, and I'm gonna move that screen slider a little faster to show you just over time how that storm kind of moved through place to place, and then finally reached our current state of where we are today. You know, as this was happening, I remember driving one day in my car and listening to Sting on the radio, the song about entitled "Fragile," And as I reflected on the lyrics of this, I decided I'm going to write an editorial about the fragility of us as a race, the human race. And this is a quote from that article that as I reflected on the lyrics of the song, I became acutely aware that despite our collective human ingenuity, scientific discoveries and technological advancements, such as these are the things we hailed as our human achievements: space travel, sequencing of the human genome, big data acquisition and analysis, harnessing of this data for AI, live connecting people across the globe, regardless of distance and time in an instant, and creating a global economic growth with trade, industry, and innovation. That despite of all of that, we remain imminently fragile and infinitely vulnerable. A previously unknown tiny little enemy, which belongs to a family of viruses that measure less than 120 nanometers and carries a genome size ranging from approximately 27 to 34 kilobases, suddenly challenged our globe beyond our capacity to fight or control it. More than 180 countries are in this battle, and world superpowers such as China, Europe, and the United States, with all their might and economic power, have been brought literally down to their knees in their fight against this tiny, unseen enemy, and continue to endure catastrophic loss of life. And if you don't believe me, you can see these pictures. The picture on the left is a big medical center that I visited in Beijing, and at noon, where this picture was taken, this street would be literally packed with people, shoulder to shoulder, and you would have no way of seeing any part of the street. To the right is one of the main shopping districts in Beijing, and this was also taken around midday. And it wasn't just Beijing, but some of the major cities of the world: London, Rome, Paris, Toronto, and New York. And that's where the United States landfall really took major shape and form. This is, I don't have a CNN tower or an Eiffel Tower or Big Ben from my balcony, but this is my neighborhood at sunset in Houston, Texas. Photo taken from my 7th floor apartment, showing how deserted Houston was. Again, looking as one of the other ghost cities that you have seen in the previous picture. So this pandemic changed and continues to radically challenge life as we know it. The impact on society is felt all over the world. Students stopped attending schools and university. Travel restrictions abound. Restaurants, gym closed. Mask faces everywhere we go. Families can only connect virtually rather than in person. And many people are working remotely or not working at all. Sports events everywhere, including the Olympics, were canceled. Conferences and meetings across the world are rescheduled or canceled. Religious gatherings are mostly online, and business or leisure travel came to a screeching halt. The economy continued to experience a free fall as supply chains were increasingly broken and markets faced unabated decline. In other words, our modern life has been turned upside down by a nanoparticle. So what is the impact on healthcare workers and their families? And I'm gonna share one little YouTube video that really went viral early in the pandemic in China. And as you know, these healthcare workers were quarantined inside their hospitals to take care of their patients, and they weren't allowed to get out. And this is New Year, so the little girl is visiting her mom from a distance. And as you know, they have the custom of sharing dumplings. And the little girl brought her mom dumplings for New Year, but she can't give her a hug and she can't give her the dumplings in person. So she leaves the dumplings on the step and the mom comes to pick it up. I found this to be one of the most moving clips, showing truly the human impact this had on our healthcare workers and their all right. let's see, that's not what I want here. I need to go back to my, oh, here we go. Sorry about that. And there is also a huge impact on healthcare beyond COVID itself. And you can see here that death in America climbed by 18%. Only 11% of that was because of COVID, but other causes of death have spiraled out of control, including things like heart disease with 5% increase, diabetes, 15%, and things like Alzheimer's by 10%. And you'll hear from Dr. Jonathan Irish about the tsunami after the earthquake. And that's because 4 in 10 US adults said that they avoided medical care because of concerns related to COVID. And the impact wasn't just on patients, but their families. This was taken from one of the inpatients at MD Anderson inpatient rooms. And I looked out the window and the patient pointed out to me that her husband was parked right in front of her window and put that sign, "I can't be with you, but I'm here with you." And then notations at the bottom to thank all the staff and show them appreciation. The impact of this on cancer was mostly noted in delaying cancer care, and clearly the risk to head and neck, given the aerosolizing nature of our procedures in the operating room, brought a lot of change on how we do business. And the American Head and Neck Society responded admirably by putting this bulletin board on its website that was full of information that could be accessed by any physician anywhere on the globe. Because we had a plethora of information, and we were really fortunate in the United States to have that, I felt compelled to talk to the publisher of Head and Neck as the editor-in-chief, Wiley, and urged them to put a full free download special issue on COVID, in which our practitioners, residents, fellows, specialists talked about all the things that you're going to be hearing about in the next couple of days. Management algorithms for head and neck cancer and how to prioritize it. Changes in cancer presentation. Are we seeing more advanced tumors? Management of the airway in COVID patients. How do we do routine testing prior to head and neck procedures? Something that now we don't even think about, but as you remember, just a year ago, this was an uphill battle to achieve. What is the proper PPE for head and neck procedures? How do we staff service lines in head and neck? Do we get our elderly surgeons out of harm's way? Our trainees really should be facing that during their training, or should they be spared? What is the role of telemedicine? How did this affect resident, fellow, and medical student training and education? The last couple of minutes I want to spend is mostly focused on our response. Was the USA different, and why? You can see our trajectory here, which we all know very well, was that of an upward trajectory, both in cases and in confirmed deaths. And but if you compare that to some of the most affected nations, you can see that the slope of our curve was distinctly different, and that goes all the way to this last month, March 2021. But I'd like to share with you some graphs that I saw early, very early in this is March of last year in the pandemic. And what's notable here is some of these Asian countries like Hong Kong, Singapore, Japan, and South Korea, and what they were able to do. And they're sort of highlighting some of the strategies that these countries were able to do early on, unlike some of the Western countries, including Europe, United States, and Canada. Also, how the curve was brought down in some of the countries, well, again, in the United States and some of the European countries, that was not achieved with the same robustness. So then the question becomes, why is that? Is it because we are less likely to comply with norms and societal pleading for us to do things that are for the common good, even though it might infringe on our personal space and personal freedoms? So these are the kids in China that are in first and second grade, and they don't know how to stay 6 feet apart. So I found this to be very innovative and sort of funny, but not really. But the kids thought it was hilarious, and they got very fashionable with it, and everybody complied. So I read quite some time ago a book called The Organization versus the Organism, and it gets to this choice of, is individual freedom more important, or is the common good of society more important? And is that truly a binary choice? And I submit to you that it's not. We are indeed the land of the free. And not only that, the freedom between what constitutes, in my mind, is 50 neighboring countries with their own borders and their own sort of independent autonomy of structure, continue to freely have people moving from one side to the other and without any infringement on that freedom. We're also highly connected with highways and airports and more than you know it in terms of population movement. And I think this is a quote from the article: "The global differences in response may be the results of differences in culture, government, political structure, values, and resources. Freedom, autonomy, and individual liberty are precious values in the United States and form the basis of our democracy that we all treasure. Over the years, Americans fought to protect this democracy and sacrificed their lives to maintain that freedom, a choice that I would personally today make if needed to preserve it. I pray, however, that our freedom and autonomy does not cost us avoidable and catastrophic loss of life in the fight against this pandemic." I wrote this in April last year. At times such as these, our collective sacrifice of personal freedom for the good of our country and fellow citizens is critical. During this unprecedented crisis, we need to demonstrate that our democracy is actually our strongest attribute, not our greatest vulnerability. But did we really do that bad? And you know, they say that there are 3 kinds of lies: lies, damn lies, and statistics. So I'd like to share with you first that we are a big country. So perhaps what we really need to look at, not only the total number of deaths in the United States, but per 100% population. And all of a sudden, we're really not just number 1. And even more, if you look at the observed case fatality ratio, in other words, of all the people infected, what is our fatality ratio? And you can see that we drop way down the list of some of the most affected countries. And that is a testament to the hard work, ingenuity, and outstanding performance of our healthcare system that we should all be very proud of. That leads me to the last bit of my wrapping up my talk, that we're not just land of the free, but home of the brave. And with that, I mean that the American spirit rose to the occasion and showed a determination to face any challenge with a matching resilience. Examples of that: in New York, 40,000 physicians, instead of staying in retirement, they went back into the workforce to try to put the pandemic under control in New York City. Most of them were 65 years of age or older. The New England Patriots organized a very complicated transport of PPE from China on a private jet that belongs to that sports team, that involved a very elaborate organization between the United States and China, and 2 governors, one Republican and the other Democrat. Our military engaged in building hospitals, providing personnel where needed, and large-scale logistical support, even with vaccine distribution today. Civilians in every household, including my own, produced homemade masks. And these are just a few examples. When I returned from my surgery from MD Anderson and I stopped to grab a Chick-fil-A, they gave me a free sandwich. And they wrote that on my takeaway package. Some of our students from China send us PPE when we need it. And of course, humor is abounding in any culture, but most notably in American culture. So in closing, I would like to sort of share with you some of the innovative things that came out of this, matching the American spirit in the last year or so. 3D printing, several hospitals and scientists were racing to develop more therapeutics. That's why our case fatality ratio is so low. The power of data, technology, and harnessing and AI to predict what's going to happen next. Telecommunication has been applied rapidly in telemedicine and in learning. And leaders everywhere, particularly in the healthcare industry, rose to the occasions, including clinics, ICUs, emergency rooms, and hospitals. And our profession was one of sacrifice, dedication, and heroism. I think that we should all be very proud that we have produced some of the best vaccination platforms in the world today, with the best 3 top vaccines. And while we were #1 when we fumbled, we are also #1 when we recovered. And we couldn't be more proud of where we stand today with our vaccination program. And that really is, again, a testament to the resiliency of our country. The vast difference between our vaccination platform and the rest of the world is evident in that slide. And that is really bringing everything back down as it should. So my last slide that I'd like to leave with you today is this. If there is anything we have learned from this year, is to take a healthy measure of humility. In contemplating our vulnerable and fragile existence, we all now have to reset our barometer of humility. Our collective humility as humans will probably be an essential weapon in this fight by enhancing our global collaboration and coordination regardless of geography, nationality, economic power, political system, social structure, or culture as we face this common threat to our life and even our own survival. When we prevail over this pandemic, we will have learned so much from each other and will be ever more ready to face the next challenge. It is our duty and our honor. Thank you so much for giving me your time in this early morning, and I appreciate your attention and the honor of presenting. Thank you.
Ehab, thank you so much for sharing your experience with us today, and for all the work and everything you've given to the organization, to your medical center, to all of us as we have engaged in this effort. And as always, you've encapsulated it beautifully, and I thank you for your time today.
Thank you.
It's my pleasure now to introduce Dr. May St. John, who will have the unenviable and Herculean task of offering us a recap of COVID. I can think of no one better suited for this. Dr. St. John is a really salient thinker and been an important leader at her medical center and nationally with issues related to COVID. She is a professor and chair of the Department of Otolaryngology, head and neck surgery, as well as the Thomas C. Calcaterra Chair in Head and Neck Surgery at the David Geffen School of Medicine at UCLA. So with that, I welcome May St. John and look forward to her thoughts.